Hello, very good evening, everyone. How are you guys? So, we are going to start our session today. And before beginning the session, can you please acknowledge is everything fine at your end? Audio video is fine. Just acknowledge once is everything fine at your end? How are you guys? Fine? Should we start the discussion? Yes. So basically today we have got this session for INICET questions recall. Basically these are the recall based questions, है ना, which were asked in the INICET exam, and now we'll be kind of, you can say, revising them together. Okay, so let us start. All right. Okay. Then, all right, dear students. So this is the first question. What is your answer? Let us revise this human anatomy part from the MDS entrance exam point of view, and these are the INICET recall. Okay, and everything is fine that you have given. Give me heads up. So let us now start. Which of the following is not a sensory cranial nerve? Optic, olfactory, hypoglossal, vestibular. What is your answer? So we all know it's very easy question, right? So optic nerve is for the vision, olfactory is for the olfaction, that is sense of smell. Vestibular is for the it's a part of the eighth nerve, that is also sensory. So hypoglossal is the answer, straightforward answer, hypoglossal nerve, because hypoglossal nerve is nothing but the motor nerve supply. It is going to supply all the muscles of the tongue, right? Now the next question is this: all these bones are part of axial skeleton except. All these bones are part of axial skeleton except. So we know that hyoid bone, occipital bone, vertebrae, they all are present in the axis of the body. So they are called as axial skeleton. They are called as axial skeleton. But of course, among these options that we have to choose, and we know that scapula is the bone which is not coming in the direct axis, right? It is present in the lateral aspect, right? So we have two scapula that is connecting the upper limb, right? And on the medial aspect it is connected to the muscles, right? So that's why that D, scapula, will be the correct answer. Next question is intervertebral joints between the intervertebral disc. What type of joint is this? So when the two bones are coming for the articulation, right? When the two bones are coming for articulation, their ends are lined with the help of hyaline cartilage. Their ends are lined with the help of hyaline cartilage, right? So we have, this is hyaline cartilage on this side also, on this side also, but in between we have the articular disc, right? This disc thing is the fibrocartilage. So overall it becomes what? Secondary cartilaginous joint, because now the configuration is bone is there, hyaline cartilage is there, then fibrocartilage is there, then again hyaline cartilage is there, and then bone is there. So basically we have the bones which are connected with the help of this kind of a mixed cartilage. That is, this is why this is called as secondary cartilaginous joint or symphysis. Okay, answer will be D, symphysis. Where will you get the gomphosis? Gomphosis joints kahan milenge? Where will you get the gomphosis? Gomphosis will be seen between the you can say gum and teeth. Between the gum and teeth, you will see gomphosis joints. Okay, so far so good. Now joint between epiphysis and the diaphysis, right? Joint between epiphysis and diaphysis. It is quite similar structure that we have discussed just now, right? But one difference is there, that here we will get two bones, that is two bones in between two bony parts connected with the help of cartilage, So if I draw and explain, I can say this is the bone, this part is called as epiphysis, this part is called as epiphysis, and this part is called as diaphysis. So the shaft of the long bone is called as diaphysis and the end of the long bone is called as epiphysis, but in between these two bones in the growing part we have, this is what is called as epiphyseal plate, which is made up of hyaline cartilage, like this. So this, between the epiphysis and diaphysis, this cartilaginous plate is there, and that is why you can say this is what type of joint? It is primary cartilaginous joint. That is synchondrosis. Now you can tell this, anyone, if you can tell this, mandibular nerve passes through which of the following labeled foramen? So we know that this particular topic, the foramen of skull, is very important topic, because directly sometimes question is asked just like this, that they will mark some foramen and then they will talk about the foramen. Maybe sometimes they talk about which structure is passing through the foramen, okay, or sometimes they give clinically integrated type of question. So in this particular case, what is given, that is certain foramens have been marked, and then they are asking mandibular nerve passes through which foramen. That is a straightforward question here, and answer will be A, because A is nothing but your oval foramen. So let me label here. We can say that this foramen is foramen rotundum. This foramen over here is foramen rotundum. This A is foramen ovale, B is foramen spinosum, okay. This C is jugular foramen, and this D is nothing but foramen lacerum. And if you revise this part with B, we can go for a quick revision over here, right? We can see this topic, right? And if you see this part, that is the foramen of skull, over here, right? And here you can see that we have the view, and above we can see this is, we have removed the calvaria, and then we can see that these are the foramen. Let us revise quickly. Cribriform plate, that is cranial nerve 1 and the COVID virus. Optic canal for the optic nerve and the ophthalmic artery, right? Between the lesser wing and the greater wing over here, we can see the superior orbital fissure, that is for the 3rd, 4th, 6th nerve, as well as V1 fibers. And here you can see that we have, that is what is called as foramen rotundum, foramen ovale, and foramen spinosum. So after this V1, here we have V2, that is maxillary nerve through the foramen ovale, mandibular nerve, maxillary nerve to the foramen rotundum, and the mandibular nerve to the foramen ovale, and the foramen spinosum we have nervus spinosum, okay. And overall mandibular nerve is okay, but overall which structures are there from the foramen ovale? That we can remember by the mnemonic MAIL, right? We have already remembered that is mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. So far so good? Yes. Now that we have understood this much part over here, that we can see that this is the foramen lacerum, which is blocked in the living state, and no significant structure will pass through it. We have the misri vein although, and meningeal artery also, but major structure, that is internal carotid artery and the greater petrosal nerve, that will pass, they will cross the upper part of the foramen, right? And what is this plate of the bone? This plate of the bone is the petrous part. In the petrous part, we have internal acoustic meatus, and in the internal acoustic meatus, who will be passing through? That is seventh nerve, eighth nerve, and labyrinthine artery. Okay, so this is what we need to remember. And not only that, behind that we have got jugular foramen over here. We can see jugular foramen over here. Through the jugular foramen, who is going to pass? That is 9th, 10th, and 11th nerve. And further behind, if you see, that is through the hypoglossal canal part, we have 12th nerve passing through. This is basically overall the structure, that is foramen of skull, and different structures passing through foramen of skull. Okay, we have the biggest foramen here, that is foramen magnum, and who will be basically passing through the foramen magnum? It is the lower end of medulla, along with you can say spinal accessory nerve, all right, along with vertebral artery, spinal artery, and vertebral venous plexus. I hope that makes sense. And now that we are done with this part, let us again move on to the questions. So answer in this question is particularly, that is foramen right. Now the next question is nerve supply of the muscle labeled as B. Now first of all, what is this B muscle? So if you can, if you get this type of picture, you have to first identify that what are the muscles labeling over here, right? So you can see, to start with, you can see this structure over here. This is trochlea. If this is trochlea means pulley. Then what will be A? This will be superior oblique, because superior oblique, it winds around the pulley, and that's how it becomes oblique. Okay, and this superior oblique or the trochlea part lies in the medial aspect. So if you know the position of the trochlea is there, so accordingly what is B is medial rectus muscle, because now we have found out what is the medial side. What will be D? Will be the lateral rectus muscle. Do you appreciate now? What will be C? That is superior rectus muscle. What will be E? That is inferior rectus muscle. And what will be F? That is inferior oblique muscle. So this is how we can identify which muscle is where. I have told you to determine the side, like what side is given, like is medial or lateral. We can simply see where is the trochlea. So if you find the trochlea, then rest of the things are very, very easy comparatively, right? So now we have identified all the muscles which have been given in the image, but the question says that image which is labeled as B will be supplied by what? It's very simple. So all will be supplied by the third nerve other than SO4 and LR6. So if A or D would have been marked, then we have to think of 4 and 6 respectively. But other than this, whatever muscle has been marked, straightforward answer is oculomotor nerve. That answer will be B, oculomotor nerve. Yes, dear students, next question is rima glottidis present between. Who can tell? Rima glottidis. What is rima? Rima is the gap. What is glottis? Glottis is a term for the vocal cords. Rima glottidis will be the gap between two vocal cords, right? But then we have true vocal cords and false vocal cords. True vocal cords where the vocal folds are present, and false vocal cords are nothing but the vestibular folds. So for the vestibular folds, we have the rima, that is the gap is there. That is called as rima vestibuli. Okay. So this is what is called as rima glottidis. Answer will be A, vocal folds, right? So if I draw and explain, so we can say we have like false vocal cords are there, true vocal cords are there. These are vocal cords, and this is vestibular folds. Now what are the gaps possible over here? See, one gap is possible over here is between the vestibular folds. So what will be the term? Rima vestibuli. Because it is the vestibular fold, the gap between the vestibular should be called as vestibuli. but between the vocal folds, the gap should be called as rima glottidis. Why? Because the glottic word is for the vocal cords. And then we have the gap here also between the true and false vocal cords. Between the true and false vocal cords, we have this gap which is called as sinus. So if at all they ask sinus, sinus will be the gap between vocal and vestibular folds. Okay, so that is what we need to understand here. Answer will be straightforward, A, rima glottidis. All muscles of tongue are supplied by hypoglossal nerve except. Now, if you remember in our classes, we have already talked about this, and towards the end of the discussion of the cranial nerves, we always discuss about and we make the table also, compilation table. Do you recall from the class that we always make a table, and in that we write all muscles and which are supplied by something, and then there is some exception list. Okay, so here you can say we have all muscles of tongue, palate, pharynx, larynx, है ना? Those type are there, and then they are supplied by certain nerves, and then there is one exception, right? So for example, here all muscles of tongue are supplied by hypoglossal nerve, except answer will be straightforward, palatoglossus. That's okay. Answer will be palatoglossus. But if, dear students, if you can recall from our class notes, yes, if you can recall from our class notes, palatoglossus is supplied by what? Now, who can tell me what is the nerve supply for palatoglossus? Yes, dear students, tell me. What do you think should be the answer? Nerve supply of the palatoglossus. It's very, very easy. If you recall, let me tell you again. It has got two words, palatal and glossal. See, glossal means tongue. That means it has got two components, palatal component and the tongue component. Now, it is not supplied by the tongue component, because that is why it is in the exception list. That is why it is in the exception list. So it is not supplied by the tongue, then it will be supplied by the palatal aspect. It will be supplied by the palatal aspect, and that is why it is supplied by VAC, that is vago accessory complex. Why? Because all the palate muscles are supplied by VAC. Could you understand, beta? Could you understand? Yes. So this is what we have already learned in our classes. I hope you could recall. Yes. Do you remember the rest of the compilation here? So one we have already seen, all muscles of tongue, but if I ask you all muscles of palate, let me write over here, all muscles supplied by and then we have except. All muscles of palate, they can ask. All muscles of pharynx, they can ask. All muscles of larynx and all muscles of tongue. This is what we had made the table in our class, right? And now if you can revise this part with me, if you can recall, tell me in the chat box, write in the comment section and tell me what do you think the nerve supply of the muscles of palate and the nerve supply for the muscles of pharynx. So both of them, they are supplied by VAC. What is VAC? Vago accessory complex. But vago accessory complex is having two components, that is vagus and cranial accessory, right? Vagus and cranial accessory. But if at all you have to choose one, you will go with the vagus nerve. You will go with the vagus nerve, like that. But for the larynx, if you see, all muscles of the larynx are supplied by recurrent laryngeal nerve. All muscles of the larynx are supplied by recurrent laryngeal nerve, and all muscles of the tongue is supplied by 12th nerve. This is what was the question all about. Is that okay? Is it making sense, beta? Anji, could you recall? Yes. Now that you have understood this much part over here, that what we can see, that what is the exception list then. In the exception for the palate, we have tensor valley palatini. We have tensor valley palatini muscle, which will be supplied by, what is the nerve for the exception list? That is mandibular nerve. Now again, these muscles of mastication and the distribution of the mandibular nerve, distribution of the facial nerve, ninth nerve, 10th nerve, these are certain 3-4 nerves which are very important. Then trigeminal, very important, superb, right? That we have to remember only. Basically, once you have a strong hold in the cranial nerves part, right, then you will be having a good hold in the other parts also. Okay, that is the meaning. And for the pharynx, you have one muscle that is called as stylopharyngeus, which is the stylopharyngeus is supplied by the ninth nerve. So we have tensor valley palatini, stylopharyngeus is there. That is the only muscle supplied by the ninth nerve. That is the only muscle supplied by the ninth nerve. For the larynx, we have one muscle that is exception. What is that? Cricothyroid. And cricothyroid is the muscle, only muscle in fact, which is supplied by the external laryngeal nerve. And then we have the tongue. In the tongue, just now discussed palatoglossus. We have already discussed just now in this question itself that there is one exception, what is called as palatoglossus, which will be supplied by VAC, because it is getting the supply from the palatal side and the palate is getting supplied by VAC. So far so good. Do you appreciate? Now the next question is, amygdala is concerned with what? Now amygdala is a part of limbic system. We need to understand this basic thing about the limbic system. So limbic system is present in our brain and its major concern is like having two roles. Okay, so it is having survival of the individual and the survival of the you can say species. Okay, so for the survival of the individual, right, food is required, है ना? The feeding and all these concerned, food procurement and everything, that will be the concern of the limbic system. And for the survival of the species, that reproduction is required. Okay, so that will be again a concern of the limbic system. So limbic system is basically concerned with the basic instincts of the eating, basic instincts of the reproduction, copulation. That is basically the concern, right? That is where it deals with. So among these options, right, speech, mastication and motor skills is not the concerned area for the amygdala. Rather, the fear reaction or the anything which is related to the emotional part, anything which is related to the memory part, right, those are the things which will be the area for the limbic system, right? And this answer among these options will be C, fear reaction. Answer will be C, fear reaction. Now the palatine aponeurosis is formed by which muscle? Yes, anyone? Palatine aponeurosis is formed by which muscle? What do you think will be the answer? What do you think will be the answer over here? Palatine aponeurosis. So we know that palate is having two parts, hard palate, soft palate. Hard palate is bony, soft palate is the muscular, where we have different muscles. Already all the list what we can see over in front of us is like tensor valley palatini, levator valley palatini, musculus uvulae. These all are nothing but the muscles of palate. But among these, who is making the palatine aponeurosis? Among these, who is making the palatine aponeurosis? That will be made by tensor valley palatini muscle. It is a straightforward question. Just let me show you once the diagram. Okay, and in this diagram, let me just show you this particular thing over here. So if you can recall from here, right, you can see that this is the tensor valley palatini muscle, right? This is the hard palate over here. Behind you can see the muscles, and this is the tensor valley palatini muscle. And here we have pterygoid humulus. This is the bony part around which this is passing through. It is kind of winding around part around this pterygoid humulus part. That is the tensor valley palatini of this side, tensor valley palatini of this side. This is also pterygoid humulus. So this tensor valley palatini will be passing from here both sides, and then eventually it will become the aponeurosis, the tendon part. The tendinous sheath of the tensor valley palatini muscles will be making the palatine aponeurosis. Are you able to follow, beta? Could you understand this? Yes. Everyone, please confirm. Are you able to follow this part? So what we have learned here, answer will be tensor valley palatini. We have seen just now. In fact, the next question, tendon of which muscle glides around the pterygoid humulus? Pterygoid humulus, we have seen. Tensor valley palatini, it will wind around, it will glide around the bony landmark, and after that it is going to continue the tendon part. The flat tendon of the muscle is called as aponeurosis. So that tendon will be making the you can say palatine aponeurosis. I hope these both parts are clear. Okay. Now ptosis can be caused by injury to. Ptosis can be caused by injury to oculomotor nerve. That's straightforward answer, because in case of oculomotor nerve, what will happen? In case of oculomotor nerve, what will happen? There will be LPS muscle not working. There will be LPS muscle that will be not working, and if the LPS will not be working, then what will happen? There will be ptosis. Then there will be ptosis. All right. There will be ptosis, and all the muscles will be not working, but SO4 and LR6, these two muscles will become unopposed. Only these two muscles are unopposed. Why? Because rest of the muscles which are supposed to be supplied by the third nerve are gone. So SO4 and LR6 is still working. They will put the position of eye into down and out position. They will put the eye into down and out eye position. Down and out eye. Into down and out eye position, right? So LPS will be gone, leading to ptosis. SO4, LR6 leading to down and out eye. And then here we can say ciliaris muscle. Ciliaris muscle not working. Ciliaris muscle not working means loss of accommodation reflex. Loss of accommodation reflex. Okay, and because sphincter pupil is not working, that will lead to loss of pupillary light reflex. That will be pupillary light reflex. And also because the sphincter pupil is not working, the pupil will be dilated. So pupil will be dilated. First of all, this will be dilated. Second thing, it will be fixed. So pupil will be dilated and fixed. Superficial cervical artery is a branch of, can you tell? Superficial cervical artery is a branch of transverse cervical artery, and the related thing that you should remember is that it is usually giving only one branch. Transverse cervical artery is a branch of what? Subclavian artery. Is it a direct branch? No, it is a branch of thyrocervical trunk, because thyrocervical trunk is a branch of subclavian artery. But from the thyrocervical trunk, we have one of the branch called as transverse cervical artery. So transverse cervical artery is giving most of the time only one branch, which is called as superficial cervical artery, but sometimes as a variation it may give deep branch also. If at all it gives deep branch, in that case it is going to replace dorsal scapular artery. Why so? Dorsal scapular artery is the artery from third part of the subclavian artery. But why it will be replaced then? Because if you see the course and other aspects of these two arteries, they are same. So either it will be present in one individual as deep cervical artery, or it will be present in the form of dorsal scapular artery. Both will not be present. Why? Because the course, the distribution, target tissue, everything is same. What is different is the origin. Either it may take origin in the form of dorsal scapular, or it may take origin in the form of deep cervical artery. Now do you appreciate? ठीक है, तो ये इंपॉर्टेंट पार्ट है जो हमें याद रखना है. Which of the following structure is not injured in the parotid gland surgery? So basically the examiner wants to know कि इनमें से कौन सा structure parotid gland में नहीं होता है. We all know external carotid artery is present, facial nerve present, retromandibular vein present. So what is not passing through the parotid gland is the internal carotid artery, right? Internal carotid artery is not there, so that is why it will be not injured. Next question is, which of the following extraocular muscle is not supplied by oculomotor? Very nice question. That means if you see, let me explain this way. If you see the nucleus of the third nerve, suppose this is left side, this is right side. We have the nucleus in such a way that the nucleus is kind of emerging, because the third nerve nucleus is actually a nuclear complex basically, okay? And to make it simple, we have drawn like this. So left side nucleus will send the fibers to the same side, like left sided nucleus will send the fiber to the left side only, right side nucleus will send the fiber to the right side only, and these will be supplying their all muscles. All muscles means all the muscles which are supposed to be supplied by third nerve. These will be getting the supply from the respective third nerve, but the fibers of the third nerve which are supposed to supply superior rectus, they will go like this, so they will come and they will go like this. On this side they will come and they will go like this. These are the fiber for superior rectus. That means we can say the fibers for the superior rectus particularly, they are getting decussate within the nucleus. This is called as intranuclear decussation. This is what is called as intranuclear decussation. Intranuclear decussation. Okay, that's why answer will be A. Artery palpable at the angle of the mandible. Straightforward answer is facial artery. We know that this is mandible. Suppose this is mandible over here. This will be the submandibular gland. This will be the submandibular gland. If this is the mandible, then artery, facial artery comes and makes a loop like this, right? And this is where it makes a one part of the loop around the gland, the other part around the bone. This is where you can palpate the facial artery at the angle of the mandible. Now, which of the following statement is true or false about the mandible? Mandible is the largest and the strongest bone of the face. That is what, okay, we have to first see the choices and then we have to correlate. That what is true and what is false, okay? Mandible is largest and the strongest bone of the face. That is actually true statement. Options are here, okay? You can read the option here. So mandible is the largest, strongest, true. Bilaterally it is developing from the first arch, true. Macal cartilage disappear completely, no, that's not true. Why? Because macal cartilage we have the remnant now, है ना? Remnants are there. Macal cartilage कैसे उसमें वो तो पूरा disappear नहीं होगा. That's not true. Sublingual gland lies in the sublingual fossa below the mylohyoid line. No, it lies in the fossa, but it is lying above the mylohyoid, right? Not below. That's false. So this is false. This is false. Rest are true. This is true. This is true. Now temporalis muscle is inserted into apex and the surface, medial surface of the coronary process, and also extension will be extending downwards. That's true. So here, if you compare the options, answer will be A. 1 to 5 are true, third and fourth are false. Right? Now, main source of nerve supply to the palatine tonsil. Yes, here straightforward answer, glossopharyngeal nerve. Why? This is the nerve which supplies the tonsil and oropharynx. And not only this, because of it's having like one fibers going to the ear, that is Jacobson's branch. That is the reason in case of tonsillitis, pain may be referred to ear, right? So this is one of the cause of otalgia, earache. Do you appreciate this? So far so good. Which of the following structure is not correctly matched? Inion given, that is line of the temporal line, is wrong. Inion is not seen over here. Okay, rest of the structures which have been given is true, like pragma is true. It is the sagittal suture where it meets the coronal, that's true. Lambda, intersection of the two sutures, that's also true. Asterion, this parietomastoid, occipitomastoid, that's also true. So answer will be straightforward, but let me show you where exactly this inion is present. So here, let me show you this posterior aspect, right? And here we can see here you can see this is a posterior aspect. So occipital protuberance and the highest point, that is what is called as inion, right? So that's why answer will be also over here. Okay. Infection from the palatal abscess first drains into. Here answer will be C, jugular-digastric, because the soft palate lymphatics will be draining to the either retropharyngeal or directly into the deep cervical. And in the deep cervical, jugular-digastric will be the answer. Now this question is a patient suffering from maxillary sinusitis. According to the image shown, drainage of the maxillary sinus is from. Okay, forget about the image. We know that in the middle meatus of the nasal cavity, we have FAM structure, right? We have FAM structure. What is FAM? Frontal, anterior, ethmoidal and maxillary. So that is why answer to this question will be middle meatus. Do you appreciate? Let me just show you this nasal part. Here you can see, right? So in the inferior meatus we have nasolacrimal duct. In the middle meatus you can see that we have the middle meatus part, we have the bulla ethmoidalis and also we have the hiatus. So basically we have front, this is the FAM structure, frontal, anterior ethmoidal and the maxillary, and here you can see the middle ethmoidal, this is posterior ethmoidal, and this one is the sphenoidal part. So this is what we can learn about different parts. And in this given section, always you remember, whenever you get such type of question, the sagittal section is given to you, you must also look at the posterior aspect of the inferior concha. That is the opening of eustachian tube. That is the opening of eustachian tube. ठीक है बेटा, यहाँ तक समझ आ गया आपको? So far so good. Now where are the adenoids present? Now very straightforward. So if you look at the wall of the nasopharynx, this is the roof is there, roof of the nasopharynx and the posterior wall of the nasopharynx. At the junction we have nasopharyngeal tonsils. which gets inflamed, that's we called as adenoids. Answer will be straightforward. A. Nasopharyngeal tonsils only are called as adenoids. All will pass from jugular foramen. Now we have already just now discussed all the foramen we have discussed, and we know 9th, 10th and 11th will be passing, but hypoglossal nerve will be passing through the hypoglossal canal. That's why this will be not the answer. Which nerve will be damaged due to trauma of the superior orbital fissure? Now straightforward, we know that third, fourth, sixth and also V1 fibers. Third, fourth, sixth and also V1 fibers, those structures will be passing. So oculomotor as well as ophthalmic nerve, both will be gone. Which of the following is not true? Cricothyroid tenses the vocal cords is a true statement. Transverse arytenoid adducts the vocal cord. Yes. Posterior cricoarytenoid abducts the vocal cord. Yes, that's true. Thyroarytenoid abducts. No. Only one abductor is present in the larynx, that is posterior cricoarytenoid. That's why D will be the false choice. And posterior cricoarytenoid is also called as safety muscle. It is also called as safety muscle. Do you appreciate this? Okay? Because it can abduct the vocal cord and the respiration is feasible. Otherwise, respiration will be affected. Thyroarytenoid will do the adduction. In fact, let me tell you, these muscles of the larynx, either they are involved in the adduction or they help in adduction. Either they can themselves do the adduction or they can help in the adduction. But regarding cricothyroid, they will tense the vocal cord. Thyroarytenoid, also it will relax the vocal cords. Okay, and there is one muscle vocalis which will do the segmental tension of the vocal cords, Now what will be the answer here? The function of mylohyoid. Now see, mylohyoid, just forget about everything you imagine in your body. What is the mylomandible? Where is the hyoid here? So what we are talking about, the muscle suprahyoid or infrahyoid? What we are talking about the muscle, it is the suprahyoid muscle. So when the muscle will pull, the generation of the contraction of this muscle will definitely lead to the elevation of the hyoid bone, because the muscle is above it. When the muscle will contract, the hyoid will move up. Do you appreciate this part? Could you understand, beta? If you want, I can show you the diagram also, but I will suggest like certain things you can visualize on your own, right? So I hope this part is done up to this much. These questions are done. So far so good. Whatever we have done so far, is it all clear to you? Next question, optic canal is a part of. Now if you see the foramen, mostly foramen, they are part of single bone, and in the sphenoid bone we have, majority of the foramen present. Okay, that is what present over here. But there is one foramen which is contributed by the three bones. There is one foramen which is contributed by the three bones. What is that? That is foramen lacerum. Foramen lacerum will be contributed by three bones. Now Kieselbeck's area is, what is Kieselbeck area? Kieselbeck area is seen in the nasal septum part, inferior part of the nasal septum. This is the Little's area, where the plexus name is the Kieselbeck's. Actually area name should be little area. Better term for the area is Little's area, but the plexus name is Kieselbeck's plexus, formed between the arteries. These arteries are here. This is anterior ethmoidal artery. This is anterior ethmoidal artery. This one is sphenopalatine artery, and this is greater palatine artery. This is greater palatine artery over here. Greater palatine artery in the hard palate. This will be, see, nasal septum. Below we have the hard palate. So this greater palatine artery is anyway present in the hard palate, but it will give one branch to the nasal septum. Over here. And now if you look at the surface level, we have the nasal septum. Below we have the upper lip, and upper lip ke liye we have the term superior labial artery. We have the artery superior labial artery, which is anyway present in the upper lip part. It will supply the upper lip, but after this it will give one branch to the nasal septum. Okay, like this you can say. So we have the litus area where we have the Kieselbeck's plexus. False statement about eye muscles. Action of the inferior oblique muscle will be elevation, abduction, extorsion. Inferior rectus will be doing the depression, adduction, extorsion. Lateral rectus supplied by abducens. Action of the medial rectus is abduction. That's completely wrong. Action of the medial rectus has to be adduction. It is the adductor muscle. Okay, and what is the abductor muscle? Completely abductor, only abduction, that will be lateral rectus. That's why straightforward answer is D. Now sphenoidal sinus we have just now seen. We have discussed all the sinuses. We have seen the meatus part, right? We have seen, let us revise. Inferior part में कौन था? Inferior meatus में आपका the duct was there, nasolacrimal. Middle meatus में कौन था? Fam, frontal, anterior ethmoidal and maxillary. Along with that middle ethmoidal also. Posterior ethmoidal कहाँ पे था? Above, superior meatus में. उससे भी ऊपर sphenoethmoid recess में you have the sphenoidal sinus draining. So answer will be D. Not a branch of external carotid artery. So we know the branches of the external carotid artery. What are the branches? One medial, that is ascending pharyngeal. Two posterior, posterior to the auricle and the occipital. Three anterior, superior thyroid, lingual and facial. And two terminal, that is maxillary and superficial temporal. And also dear students, there is one update. What is the update? What is the first branch according to the Gray's 41st edition, that means last edition? तब तक क्या लिखा हुआ था? Superior thyroid artery was the first branch, but now in the Gray's 42nd edition, according to Gray's Anatomy 42nd edition, now the first branch is ascending pharyngeal artery. Ascending pharyngeal artery, that will be the answer. Do you appreciate now? Ascending pharyngeal artery. So please update your notes also. According to Gray's Anatomy 42nd edition, first branch if they ask, answer will be ascending pharyngeal artery. Next question is muscle responsible for frowning. There is no concept, right? These type of things that you have to simply mug up. And I have already given you one table of the muscles of the facial expression where you have written like what are the muscles responsible for different type of expressions. So if they ask frowning, corrugator, superciliary will be the answer. And simply this, as I said, ये तो आपको मगअप ही करना पड़ेगा बेटा. Now what is the most common cause of epidural hematoma? Yes, anyone? Epidural hematoma, answer will be middle meningeal artery, specifically anterior division. Specifically anterior division. But if they ask subdural hematoma, then in that case there will be veins, bridging veins. In that case there will be bridging veins. But if they ask subarachnoid hemorrhage, so epidural hemorrhage, middle meningeal artery, subdural hemorrhage, bridging veins. Bridging क्या था? Veins थे. Subarachnoid में we have like berry aneurysm. Subarachnoid में berry aneurysm. And intracerebral, we have Charcot artery. Now which fontanelle closes at last? Now इसमें दिया हुआ है कि ये like anterior, posterior, etc. है ना? तो इसमें से आंसर है anterior, because this is again kind of a timeline that we can simply remember. This is what I have included here. Simply go through this particular part. Anterior fontanelle 13 to 24 month है, ठीक है. Posterior fontanelle 6 weeks है. तो सबसे पहले posterior, उसके बाद 6 months में कौन है? Sphenoid. 6 to 18 month में कौन है? Mastoid. 13 to 24 में कौन है? That is anterior. So anterior is the largest also, and anterior is the most important also, and the anterior is the one which is closing at last, and posterior is the one which is closing at first. Like सबसे पहले earliest वही close करेगा. तो कुछ see The idea of this session is not only to know the answers, as what we are doing, we are looking at the topic as a whole. Okay, I will also suggest the same for you. You look at the topics, look at the questions and answers, that's okay, but along with the answer you must see the other choices. You must see the relevant related part of the theory from the notes, okay, from the notes itself, because all these things have been already covered in the notes. All right, dear students. So like that, and then we have which of the following structure developing from the third pharyngeal pouch. Third pharyngeal pouch, say we have inferior parathyroid along with thymus. Along with thymus, this ultimobranchial body and the superior parathyroid, these both are coming from fourth pouch. In fact, I have given you the list from the latest book of Langman's embryology. I hope you remember that part, that in the Langman's embryology it is given, I have given you the list. Pharyngeal pouches हमने क्लास में डिस्कस भी करा था. Pharyngeal arches, pharyngeal pouches. I told you pharyngeal arch is the mesodermal, pharyngeal pouch is the endodermal, pharyngeal cleft is the ectodermal structure. And also let me give you one more update. Earlier we said that first pharyngeal cleft, earlier we said that first pharyngeal cleft, that means ectodermal structure, it is going to make the external acoustic meatus. External acoustic meatus, ये previous description था. Okay, earlier we have taken the notes this much, but the Langman book has come with the latest addition and there is an update. In the Langman's book 14th edition, what is written, that it is actually not the first cleft, but actually it is the first arch which makes the external acoustic meatus. That means if at all any question is asked that who makes the external acoustic meatus, what will you mark? You must mark first arch, not the first cleft. ठीक है, first cleft पुराना था क्योंकि पहले वही बुक्स में दिया भी होता था, हम क्लासिकली पढ़ते भी वही थे, right? But now the Langman has come with this update. So whatever update has come, you please follow that. In the Grace 42nd edition, as I have given you the update, now the first artery from the external carotid artery is not superior thyroid, it is the ascending pharyngeal artery. Now this question, metopic suture closes at, ये भी एक ऐसा क्वेश्चन है जो बच्चे बार बार डाउट पूछते हैं, but answer is 9 month. Actually what is given in the Gray's anatomy, that this fuses within first year. This fuses within first year, that is what is given. Okay, in the previous editions it was very vague and very late written, but we should not follow what was the previous description and all. What we have to remember is the latest information, and according to the latest information, dear students, metopic suture will close at 9 month, or whatever choice has been given within the first year, that should be the answer. That is according to Gray's anatomy. So far so good, yes. And now the next question is, Woodruff plexus is present in. Woodruff plexus is present in. Now what is Woodruff plexus? See, the scientists have researched for the Kieselbeck's plexus, and scientists have researched for the Woodruff's plexus. Now let me tell you one very interesting thing. Kieselbeck's plexus is extensively studied and very well defined arterial plexus. Now coming to the Woodruff plexus is also for the epistaxis. Kieselbeck's plexus is also for the epistaxis. Both are for the epistaxis, but Kieselbeck's is arterial, Woodruff is venous. Kieselbeck's is very well established, very well defined anatomically, but Woodruff is more of clinical. Okay, तो ये हमें याद करना है कि ये कहाँ होता है. Woodruff plexus is for the posterior epistaxis. ये anterior epistaxis का part नहीं है. Woodruff plexus है, it is present in the posterior part of inferior meatus. That is why it is concerned with the posterior epistaxis. Posterior drip होता रहता है, posterior nasal drip, तो उसको protect करना होता है. तो basically it is more of kind of, you can say, clinical term. Okay, anatomically उतना well established नहीं है, although lot many researches have been done, lot many papers have been published and everything, but the conclusion is it is the venous thing. It is responsible for the posterior epistaxis and it is present in the posterior part of inferior meatus, right? So that is all, dear students. This is what I could get the recall from the previous year questions which have been asked in the INICET exam. I hope everything was fine, dear students. And as I told you in the classes also, that you have to keep on believing in yourself, beta, है ना? If you start believing in yourself, definitely God will help you, and definitely miracle will happen, right? This is very very important part of our life now, that we are very close to the exam. When we are very close to the exam, don't you dare to give up now, okay? Just give एक्स्ट्रा पुश, ठीक है? कीप ऑन पुशिंग योरसेल्फ. अभी ये लास्ट की तरफ है, बट अभी हमें समहाउ करना ही है, बिकॉज इट वाज आवर ड्रीम ऑल अलोंग, है ना? तो अगर हमारा ड्रीम है तो उसकी कॉस्ट भी तो हमें ही पे करनी पड़ेगी ना. व्हाट इज द कॉस्ट? दैट हार्ड वर्क दैट वी आर पुटिंग इनटू, राइट? सो ऑल द थिंग्स विल, it will be really worth it. I'm telling you, once you crack the exam, you will be really very happy, and you will feel that whatever hardship that you have gone through is all worth it, okay? So my dear students, keep on working hard, do not give up, okay? We are all in it to win it, okay? Best wishes, dear students. So this is my Insta ID. Let me just show you. Okay, this is my Insta ID, and the other my information, like, let me just share with you. So if you have anything to connect with me, okay, this is, please note it down. I have one Telegram group, and I have, this is the Instagram and the Facebook page. You can be connected with me on any of these particular, you can say, any of these medium, whatever social media that you prefer, right? So you send me the message, any doubt, feel free to ask, and I will try to answer as soon as possible. All the very best, dear students. If you have any doubt, just feel free, okay? Keep on working hard. God bless you all.